That Peruvian sun just won't quit.
Steve-O.
I could wear
Oh my gosh.
sombrero, but where am I gonna find one around here?
Oh man. Whoa. That's disgusting. Now, that was a ton of jellyfish. They have these long tentacles that if you get touched by them, they freaking hurt. Thing like how they cause swelling. And don't pee on your friends. What the heck? So typically to get them out of you, because they leave these little things in there, is vinegar. It helps neutralize it. If you guys are around jellyfish, please don't pick them up. Stay away from them. They're not things to like play with.
Oh, we have a load of bees we're gonna put through the sunroof, and we rigged the locks so they can't get out.
Ha! And when they do get out, we got a couple marbles for them.
I'm assuming they know that their buddies don't have allergies to bee stings. It can cause anaphylaxis. Treatment for allergy to bee stings ends up being epinephrine and EpiPen. If you do use an EpiPen, go to the hospital and get monitored. Oh my gosh. Oh my gosh.
Dude, close that sunroof, dude! Oh, we're locked in!
Oh my gosh.
A little less conversation, satisfaction.
No way. I hope they're not allergic to bees. Nice, even the limo driver's out. You can potentially die from getting so many bee stings. It overwhelms your system so much. So be really, really careful. And it's even messed up that they open the door and they put marbles out, so that now they're slipping on the floor. It can cause potentially fractures, contusions, abrasions. What nice friends they have.
This is the Poo Cocktail Supreme.
Oh my gosh. What is this? This is in a porta potty. Oh, at least you got his nose clipped.
Oh.
Order up!
You gotta be so careful you don't have any like open wounds or it gets in your eye. Usually urine is sterile, but your poop is filled with bacteria. You can get really bad infections, cellulitis, that sort of thing. This is disgusting. Oh, man. So Shigella, neurovirus, hepatitis, tons of different viruses, bacteria harbor in poop. It's disgusting. Don't do this. Don't ever try this at your house.
Aaron's walking in, and we're going to have him bring in a whole tray full of soup.
Okay. But then the soup, if the soup's hot, it can get like 1st or 2nd degree burn, maybe even 3rd degree burn.
What up, Aaron? What's up, dude?
Got a soup.
Here to help out this crowd, brother.
Oh my gosh. Okay, one, he's got traumatic injury. It's blunt trauma. He should be okay. We get so many people that come to the hospital where they spill soup or hot coffee on themselves and literally their skin's like sloughing off on the areas where they've actually gotten burned. Because if it's so bad, you have to get a skin graft. You take the skin graft from typically your thigh or your own buttocks and then have to put it on the area where you've burned. Oh no. Paintball. This is gonna hurt.
Ready? Aim. Fire.
Oh, right into the solar plexus, right, you know, mid chest, and then the bruise that's there, it welts up. Sometimes you can actually even break the skin. Oh, that's good. I wonder which one hurt the most. The thighs. Oh yeah. Oh, the thighs. Look at that. Woo! All the tissue around his groin. You see all those welts there? Oh my gosh. You get these bad bruises. You're actually having breaking of blood vessels underneath the skin. That's what's happening. It takes like a week or two to go away and they change color. They go from, you know, these dark blue, purple to like green, yellow. And that just has to do with the breakdown of the blood cells themselves. Oh yes. Give me some sushi. Oh, he's mixing wasabi with soy sauce. Wasabi in itself, when you eat it, right, if anybody's had it before with their sushi or anything else, it's this like weird heat burning sensation that you already feel in your sinuses. Don't do it, bro. Oh, it's gonna burn. Don't snort things. Look at this. Don't snort things in your nose. The tissue there is very sensitive. You can cause a lot of injuries and bleeding. Oh, he's doing it the other side. Oh, and his vomiting, awesome. And it's probably not going away anytime fast, which then his body's then reacting, but then vomiting because it's so bad. Do you guys know why they give you the ginger? It's not just to clean your palate. It's actually to help counteract too much wasabi. Oh, nice skills.
Knoxville, and I'm going to grind this rail.
Hey, at least He's wearing a helmet. Wearing a helmet when you're not good at something is excellent. When you're really good at something, you probably still should wear a helmet, and you always have a risk of hitting your head, and I don't want you to crack your skull open and visit me at the hospital.
Ready, set, go.
Oh my gosh. Balance, kid. Oh! Landing on your side of your head, he's got a helmet on, but you gotta really be worried about the middle meningeal artery, which is actually an artery on the side here, which if you pop it open by accident due to like a skull fracture or traumatic head injury, it can cause an epidural hematoma, which then causes almost like a lens tape bleeding in the head, and then potentially can cause a lucid interval, and then cause herniation of your brain, and you could potentially die. Oh my gosh. His friends are so messed up. Yeah! Gotta be really careful. He could fracture the head of his humerus. If he rolled his ankle, he could snap it pretty easily versus a sprain. We don't see him getting up, but it looks like it hurts pretty bad.
This treadmill show.
Treadmill show, oh god. Any fall greater than 3 times your height is super dangerous. So maybe on average, maybe like about 15 feet. Oh! Actually, it looked like kind of a lot of fun, actually. We also see a lot of people who fall and try to land on their 2 feet, which then can cause calcaneal fractures, which then could also cause vertebral fractures due to the energy going up. And then obviously you can twist an ankle, roll an ankle. Please, if you do fall from heights, try to like fall and roll so you take some of the energy off so you're not getting so compressed. Oh, I don't think you can do that. Nice. People are like, what the hell? Oh my gosh. Doing it again. Nice. Oh! Strike. Oh my gosh. Okay. So at least they're wearing a helmet, but those pins are like solid wood. That's not cool. His friends are messed up by throwing bowling balls after him. It looks like one hits the guy right in the butt, potentially into his berries. And now you could have like bruising of your testicles. You gotta be really, really careful. You know, you gotta worry about cervical injury, whiplash if your head's not straight, you can twist sideways. So those are the biggest things I would worry about besides having like a little bit of traumatic brain injury, concussion, those sorts of things.
I'm Dave England, and this is the Bungee Boogie.
Oh my gosh. Oh! Oh man, one, you gotta worry about your tailbone fracturing. Go to the store and buy one of those pool donuts. Sit on it so that way the pressure's on the rim of your butt versus right on the pressure where the fracture is. Oh, nice. Oh! Flies into the side of the pool and his body's all contorted. You know, that amount of force, if your brain is not perfectly filling the cavity of your skull, it can slosh around and move around. You can actually rip your bridging veins and cause bleeding in your brain. Then you can snap your neck. Bad whiplash injuries where they literally screw in an apparatus to keep your neck in one place so you don't actually cause further damage. There you go. More stable. Perfect! That's awesome! He's definitely gonna have some road rash. Road rash, all different degrees, ripping the tissue, skin off. Man, that hurts a lot. The times we see this in the emergency department where people have like horrible road rash are car accidents, motorcycle accidents. I've seen some bad road rash where people need skin grafts. The skin is gone. And literally you gotta take skin from your and put it on different areas of your body. What happens if you have a hairy butt? Like now you're gonna have a hairy patch? No, I'm just kidding with that. That doesn't normally happen.
And this is the Lamborghini tooth pull.
Lamborghini. Nice.
Here's the good news. What you're doing is stupid.
This is gonna suck.
Here's the good news. I don't know if anybody's seen or done it as a kid, putting a string to your tooth and like somebody slamming the door. Again, don't do that, okay? So this is like the over-the-top expensive luxury car edition version of that. Oh my gosh. Wait a second, before it even happens. 2 doctors on set. I don't think they're real doctors. One's in a long coat and one's in a short coat. When I was a medical student, we wore a short coat. When you graduate and you become an official doctor after you graduate medical school, then you get the long coat. It's actually like a rite of passage. The only time I ever wear my white coat currently. Wait a minute, it came to me. This is just an adult tooth. Ow! These have long roots into the bone. You can actually replant that back in right then and there. You can run it underwater, don't scrub it, don't brush it, nothing like that. It has ligaments on the tooth itself that help reattach it and keep it in place. And you basically put it back in the socket as long as the socket is clean. But if it's been too long of a period of time, then we actually can't replant because those ligaments on the tooth itself is going to become useless. The tooth won't hold.
I'm Johnny Knoxville. This is the jet ski.
Oh, at least he's wearing a helmet. So dumb. Oh! That's why he's in a lot of pain. And obviously he smashed his chest right into the handlebars. Probably also hit his gonads. You can have sternal fractures, you can have contusion of the heart, you can have blood going around the heart, we can have compression of the heart, and then you potentially die. And then you also worry about anything lower. A lot of times there are injuries where if you hit right into the epigastric area, just below the ribs, it can cause massive amount of bleeding, and it can cause internal bleeding right into the abdomen. It just fills up and fills up. Oh, I love this music. Uh-oh. Where's the wind coming from? Oh, man! Now that we know it's a jet engine getting blown in your face, one, temperature, I'm assuming it's hot. I've never sat behind one. But you're also getting a ton of debris hitting you in your face. Because the issue ends up being you're getting these even little pieces of sand get thrown into the face, can cause abrasion to the skin. Could also, if it got in your eye, it can cause a corneal abrasion. It's gonna get tossed.
I can't f***ing breathe. I felt like somebody was blowing a fireball in my face.
Yeah. At the hospital, when somebody's coming in and they're struggling to breathe, before we intubate them, we try to use different machines to help them breathe, either a CPAP or a BiPAP, blowing air into your lungs, and you're actually causing the lungs to hyperinflate a little bit and stay open. But it's very similar in this situation, and he describes that he can't breathe at the hospital, where people will describe that they can't breathe even though the machine is actually making them better. So it's really interesting, the correlation. But this type of breathing and the jet fumes and all the byproducts and the environmental things that are getting in your lungs that you're trying to breathe are not good for you.
And this is the bungee jump.
Nice.
3, 2,
Doesn't seem very high.
1.
Oh.
I see Preston coming. Once he was past me, he pulled me down more.
I love it. That's so dangerous, though. You can still have a lot of injuries even from this height if you don't fall correctly. Right when I see this, all I'm worried about is them colliding in the air and causing injuries to each other. And when you're having that type of torque of change of direction, you can snap your back, cause a herniation of a disc, and then actually you can cause whiplash injuries to your neck, which then can cause cervical fractures, spinal cord injuries. There's even a thing called a shringomyelia, where you actually get potential blood and dissection of the spinal cord down the middle, and that would actually have like cape-like abnormalities of your upper extremities. We see Wee Man getting pulled, well, bungee jumping back up, right? And then he just gets wham, whipped right into the water. Obviously, Olympic diving, you have much higher boards than potentially of this, but they're professionals and they've worked up at it, versus basically doing a cannonball or belly flop into the water that they have here. And then the other issue ends up being is the temperature of the water. Sometimes if the water is super cold, it can inhibit your breathing, causes almost like a shock to your body.
Hello, my name's Johnny Knoxville, and I'm about to end this movie.
Wait a minute. Okay, so they're ending the movie. Look at what we got. Everybody's wearing safety glasses. Good. Okay. But then we got somebody who's in a neck collar. And everybody see the neck collar? There is minimal to no use of these neck collars. I don't think I've given one of these out ever in my career as an ER doctor, because more studies have shown that they cause more harm than good. Oh, piñata. Nice. What happened? Oh! Oh! I don't know if this is real or not. It looks pretty darn real. Luckily, they're professionals. Wait a minute. The first thing that happens is like the destruction of the back wall, and all I can see is like shards of glass and drywall coming at them. Their eyes are protected, but their skin's not. They can cause lacerations, abrasions. You can actually cause puncture injuries. These actually are true injuries that we see more often than you think. July 4th in the United States, people get fireworks illegally, light them up, and different explosion injuries happen. I've seen many of them. I've seen people blow out their eardrums. I've seen tissue exploded off of people's chests. Side drywall starts caving in. You got to worry about, inhaling these particles because they're not wearing any respirators to protect them. Long-term potential risk of maybe cancer, silicosis, a lot of different things. You're getting all this water coming in, so it takes them all out. They can fall down, hit head injury, lose consciousness. Is the water clean? It's mixed in with all these particles and mixed in with the broken glass that's now floating around.
This is Beauty and the Beast!
on top of a porta potty. I love that it's got the fake abs drawn on the abdomen. Everybody's got abs. Abs are typically made in the kitchen because you just have to be a certain body percentage of fat to show your abs. Oh, airplanes! Propeller injuries on those model airplanes. We've actually seen people come to the emergency department where the propeller actually lacerates an arm, a leg, and it's actually pretty deep to where I've actually had to call in plastic surgeons because it actually goes through the muscle and the tendon. Falls from a height of probably 7 feet, 8 feet, right on his heels. You always worry about a calcaneal fracture. We have to get x-rays to make sure that there's not a compressive force going up causing a vertebral body fracture.
I'm Dave England with Aaron McGee, and this is Dizzy Boxing.
Oh man, this is hilarious. The reason why you're dizzy from being spun is your mechanism of your inner ear having to do with your proprioception as well as like the motion of your body is off compared to your senses. It's trying to settle and trying to refocus. Oh, you can refocus pretty quick. Yeah, they're focused. Now their body's back into it. Oh! Then they're actually trying to use their motor function to focus and try to hit somebody. So it's actually quite remarkable that our bodies are able to do so many different processes at the exact same time.
I'm Danger Aaron. This is the bed of nails.
Bed of nails. Rusty, dirty nails. You're gonna get a wound infection. You know, make sure your tetanus shot is up to date. It's not just from a rusty nail. There's multiple reasons why you would actually get tetanus.
It's a bed, Danger. You're supposed to lay on it.
Oh my gosh. I think a lot of people do this for different type of endorphin releases versus neurologic benefits. There's actually some therapy out there where people lay on these type of surfaces for different nerve stimulation related to the body itself.
Ow! Hold on!
The more you spread your weight out, the less it's gonna hurt.
Yeah.
I want to see what his back and his legs look like after he got off that. Is he all punctured up? Is he bleeding? Or is his skin tough enough and he was able to not injure himself?
Ah!
Oh, and there's a snake on top.
Oh God! No, not between the legs.
Those cobras look so cool, by the way. Here in the United States, definitely in Southern California where I'm at, we don't typically deal with cobra snakes, but cobra snakes definitely are venomous, so you definitely have to be careful around them, and they're just scary looking. I wouldn't want to be around them anyway. What? So you're the cobra snakes, depending on how big they are, they do add some weight, so now you're getting weight pushed down.
This is barrel surfing.
Barrel
For
surfing.
macho jerks with a death wish.
Oh, interesting. Actually, that looks like a lot of fun. It was actually really good. Oh, geez, run away from the barrels. Wait a minute. The biggest things you worry about with this, besides it looking actually fun, is falling, having a head injury, having a neck fracture, or breaking an arm or a wrist. Because they're falling, they're putting out their arms to brace themselves. You know, at least they're doing it on grass, so it gives a little bit of the dirt.
This is the bicycle backhand, and it's a competition. The faster you pedal your bike, the faster the other guy's hand goes back. And when it gets to a certain point, boom, someone's going to get launched.
Oh my gosh, it is like another version of like the carnival or the baseball and somebody's sitting on the bench above the water. It's like Peloton Extreme. Oh, they can't even use their hands. Oh! You're worried about whiplash injury, being tossed back and then forward, hitting the water and potentially losing your breath and then taking a breath underwater, the increased risk of inhaling the pool water into your lungs. So you have to be careful with that. When we see people who have a lot of near drownings, you have to be careful as a homeowner, make sure that your pools are covered when you're not around.
I'm Steve-O, and this is Fart Darts.
Fart darts. He's got a dartboard around his head, and for some reason he just has his shirt off. Oh my gosh. The control to be able to fart on command without pooping your pants, that's pretty good. Impressive to be able to use that amount of gas to actually get a dart to fly. Oh my gosh. Oh my gosh. Is that in his face? Oh. I'm glad he's wearing eye protection. The speed at which these are coming out probably won't go through the eye protection. I would actually use harder plastic, thicker plastic than nose glasses. And then, you know, keep your mouth shut so it doesn't go in your mouth. Wow. You worry about nerve damage actually hitting the superficial nerves of the face, and then actually some blood vessels that run right there. So you gotta be really careful.
That's a metal rat. It's hooked up to my nuts. I'm Steve-O, and this is the rat zapper.
He has something attached to his scrotum. Don't put any sort of electrocuting type device anywhere on your body because it can cause long-term damage, muscle breakdown, can cause kidney failure, could cause cardiac arrest. So don't do it.
Yeah, I'll turn it off then.
The rat zapper.
There we go.
This is Monster's balls.
Oh,
There you go.
Ball zapper. Oh my gosh. It looks like it's a car battery, like the amount of energy that it has. What? I actually wonder what actual effect it has on his testicles and his sperm. Does it totally make them useless? Does it kill them all? Does it mutate them? How long do the effects actually last on the testicles for making future sperm?
This is the cup test.
What? Oh, he's got a strong left hook.
I just Googled the hardest punch ever recorded. Francis Ngannou's punch is the equivalent of being hit by a Ford Escort at top speed.
What? I do not want to put myself in front of that.
His punch is the equivalent of...
Why, you don't need to read that now.
He's gonna go flying right into that fence or into that garage door. So the cup is just a hard shell with a little bit of foam around it. It's gonna hurt. It may not be able to make children because all the sperm are just gonna be shocked out of there. Oh! Oh my gosh, look at him. He's shaking in pain. He can probably cause somebody to have a lot of blunt trauma damage by getting punched by this guy.
Did you hear something break?
Yeah.
Did you hear something break? Yeah, it was called his pelvis. Besides your testicles and your scrotum, you literally have your pelvic bones down there. You have your pubic symphysis down there.
I'm Preston Lacy, here with pro kicker Josh Brown, and this is the field goal.
Oh gosh, he's a pro kicker, so he knows what he's doing. Hopefully he's wearing a mouth guard. I would have worn a full face mask like a football helmet versus just some ski goggles. Getting hit in the face like that with a ball, depending on if it's flat or the pointed end, this can cause serious whiplash injury, head snapping back. You can actually cause a really bad cervical fracture as well as an injury to the spinal cord itself, even if it's just bruising.
You guys look like idiots.
This looks like a racquetball court, and I anticipate the ball's just gonna be bouncing around everywhere. I love their outfits. At least they're wearing protection for their heads. Oh, he hit himself. Right in the neck? The biggest thing we worry about, one, you can have a
spasming of your vocal cords,
which basically is the top part of where your airway starts. And if those spasm and lock up, you're not gonna be able to get air through. And because of the trauma of the neck, you can actually cause inflammation, having soft tissue swelling of the airway. Thus, you won't be able to get any air through.
Oh, did you take it in the neck? Yeah. Oh my God.
Oh! Wow. So you can literally break the cartilage of your Adam's apple or anything in your neck. Oh my gosh, this is a bungee of some sort.
Goddamn, this is the BMX tug of war.
Okay. You're wearing a helmet. Oh jeez. But why?
Why?
Lands right on cactus plant. Cactus plant has these thorns, and they're just going to cause a significant amount of puncture wounds and injury and discomfort and pain. Increased risk of infection, and trying to get those thorns out, quite painful. Yeah, bad idea. Thrown off the couch, you get a pullback of the whiplash going backwards, and then lands forward, puts his arms out, but you increase the risk of having a fracture of your wrists or your forearms, and then obviously head injury.
This is the mini loop.
Oh my gosh. Oh geez, get some speed. You gotta get speed. Yeah, you gotta have speed so you can get the centripetal motion, so you can actually have enough gravitational pull to stay on the ramp. So That was a good first fail. Landing on your back, your arm, all these different areas, you increase the risk of having a dislocation as well as fracture. There we go. Go, 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 go. Oh, so close. Lots of fails. Please be careful. Obviously, you're gonna have soft tissue injury, a lot of bruising, a lot of ecchymosis, some contusions, and maybe even a hematoma. You can have a tire burn, which is quite common from the spinning wheel. Oh, this little bike flying around, get you in the face, you know, it can break your jaw, hit you in different areas that you wouldn't expect. So if you fall, just make sure you use your arms in the appropriate way.
I'm Steve-O, and this is the fish hook.
Oh my gosh. At least the fish hook looks like there's no barbs on the one end, so it doesn't get stuck. You can pop it all the way through it. But why are you doing this? If it had a barb, we can't go backwards on it. You just snip it on one end or the other and take it out that way. That's gotta be so painful without any anesthesia. Oh my gosh. That is awful and so not smart. Increased risk of infection because of the bacteria that are in our mouth to the cheek. You're gonna have potentially a scar now on your face.
Pretty good.
That hurt to do that to you.
If we ever have to do any type of procedures where we're causing holes, lacerations, anything like that, or cuts, we're using anesthesia. We're giving injections to anesthetize the area. The face has a lot of nerves, a lot of blood vessels. You're doing it blindly, so you just gotta be really careful of what you're actually puncturing.
Now it's time for some man fishing.
That's just awful. Get out of there, man. You can get a shark bite. I know they're rare, but not in this situation where you're teasing them. They always say don't have anything shiny and really no fast motions. And he's got a shiny thing in his mouth coming out and he's like freaking out and flailing. Mousetrap. Oh, man.
Oh, man.
I mean, who had to set all those up? That's what I want to know. Ouch. Hopefully nobody has ever experienced what a mousetrap feels like. It's horrible. It is a nasty spring. It can actually break fingers, besides causing obviously soft tissue injury and bruising. Roll quick. But they're not attaching to his skin. I wonder if it actually hurts. I don't want to try though. Oh, okay. You can see that there was a couple stuck on his skin, which actually really hurts. It's like getting pinched by something horrible. Is it something crazy, detrimental, and bad? Probably not, but it's probably quite annoying and uncomfortable.
This is the hockey cup test.
Hockey cup test. I don't know if anybody out there has ever worn a cup before. It's not like this massive cushion to protect your gonads. It's piece of plastic pretty much that just covers the area. You still feel it, you just don't feel it as bad as there was nothing there. Oh my gosh, that's gotta be so painful. It's so dangerous. Hopefully it didn't crack. All I can think about is if the plastic cracks and causes a laceration to the penis or to the scrotum, and then you have a testicle that just comes hanging out. This stuff does happen. Awful. You have your major blood vessels just to either side of your genitals, hitting the artery, hitting the vein, hitting the nerve. You got to be really careful. They all run right together, right next to each side. So that's another increased risk of having a ruptured blood vessel in that area, which can cause even more complications. Oh, geez. Oh, right in the groin.
My groin!
Taking anywhere between a 6 to a 14-pound bowling ball to your groin on the backside. It could hit into the ischial tuberosities, which are the bones that you actually sit on, and you can actually fracture those. You can't actually really get them fixed unless it's totally trashed. You just walk on it because it's actually not a weight-bearing fracture, so it just hurts. Ouch. Sliding headfirst into these pins. You can actually get horrible fractures of your neck. You can have an extension injuries. You can actually cause an injury to the spinal cord itself where you actually cause a tear or you actually get blood going down the middle of it called the syrinx. So a lot of bad things that can happen. Oh, geez. That bowling pin, metal crate looking thing can come down and potentially crush you. Also, you guys ever slide bare skin on a gymnasium floor that has that lacquer all over it? It's gonna take some skin off. Awful.
Knoxville knocked my nuts in half.
Oh, it did actually hit his testicles. If the board is too far forward and it looks like the ball maybe bounced up underneath versus does the tissue of your legs and your buttocks stop it before? You never know. It might be hanging really low. Oh, man. Oh, my gosh. No. Wait a minute. You have to worry about your hairs getting singed. If that happens, oh, the smell is horrible. If it gets too close to your skin, you're gonna have potential 1st degree, 2nd degree, 3rd degree burns. And then you have to worry about breathing in the fumes. You can actually cause some inflammation to your upper airway. Oh, get him, get him, get him, get him, get him, get him. Oh my gosh. Well, he falls and he lands on his feet. So you got maybe a fighting chance for a couple seconds. But then he falls and lands on his hip, his butt. Highly likely that it turned from a 1st degree burn, which is like a sunburn, to a 2nd degree burn, which is really, really painful. All right, first off, he's wearing a helmet. We got safety. Oh. Whoa.
You all right?
Why?
I think it's like the.
Oh no, clavicular fracture. Wait. No, AC separation. Oh, what? Looks like he has some sort of clavicular damage or injury. Falling either directly on your shoulder causing compression, it can snap. Falling with an outstretched arm, which puts the force there. Typically, it's just a sling and it's gonna heal on its own. Oh, nice. An ice plunge. Nice flip, buddy. Going in ice cold water. Super good, releases cold shock proteins, releases norepinephrine, epinephrine, producing good, happy feelings. But sometimes cold submersion could cause you to spasm, seize up. You might not be able to swim out of a situation like that. Oh, that's nice and cold. Good work. He's so happy. I love it. He's happy because he's so energized. I did this actually the other day. I threw 20 pounds of ice into my tub and just sat in it. My wife thought I was crazy.
I'd like to try to break the most light bulbs that anyone has ever broken with testicles. Done.
They're gonna pop easy, right? Because they're fluorescent type light bulbs that you use overhead, but they're like super shards of glass that potentially can rip his scrotum open.
A row of 36 light bulbs with my balls. Wish me and my balls a lot of luck.
At least he is covered clothing-wise, and he's wearing eye protection. Normally, Steve-O's wearing a Speedo, so it was weird to actually see him clothed. Oh, nice, nice. It actually kind of looked fun. Every now and then, everybody likes to break something. In this situation, thank goodness his scrotum and his balls were actually covered, because if you did it bare, then it can cause a significant amount of lacerations.
We're gonna play the black eye game, and here's how it goes.
Oh. Oh my gosh.
That looks pretty good.
Wow, okay, oh my gosh. Black eye is due to the pooling of the blood on the underside. There's a bone in the middle called the lamina paprisha. Typically, if that has a crack in it, will allow blood to kind of seep through. What the hell is that? Very poisonous, but not deadly for humans. That thing is gnarly. This freaks me out. Even when I'm doing my job and I'm pulling out a bug in there, I got a good game face. But inside, I'm like...
Once a WB, always a WB.
Oh my gosh. Oh my gosh. Is he chewing it or is he letting it in his mouth? Oh my gosh. That is ballsy. No way would I do that. No way.
No way.
Imagine like the spider bites your tongue and you have an allergic reaction. Your tongue is like huge and swollen. No, 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 no. Ow, did he break his leg? What the heck? Super cool in the air, but... Oh! Okay, wait a minute. Does a really good job as he's falling. His knees are bent, but then what happens is he actually lands a little bit more stiff unexpectedly without the board under him. Oh, yeah, I told you. Man, that's either a dislocation or a fracture dislocation. First, he should come in with it splinted. We actually try to put dislocations and fractures back in place as quick as possible. You increase the risk of arthritis in the future the longer it's out.
My right ankle was dislocated as and broken in 3 places. That's a mess.
Basically, you're fracturing both malleoli, so your fibula and your tibia, and then the backside is disrupted. It's called a trimalleolar fracture.
I fractured my left heel too. So I'm going into surgery in 2 days. I'm having a plate put in with 9 screws.
So if you fracture your calcaneus, which is your heel bone, you always worry about fracturing any part of your spine because of the amount of force that it takes to break that bone is a lot.
2 days, I'm having a plate put in with 9 screws. Yep. 7 on this side, 2 on the other side. But whatever, I heal like Wolverine.
He heals like Wolverine. I love it. You know, I wonder how much metal is actually in Steve-O's body. Palm trees have like little splinters all over the trees. You have to worry about getting impaled by the branches and scrapes and obviously falling from that height. Nice. Ouch. Hopefully he knew that that table would collapse because sometimes the tables don't collapse. It can cause a significant amount of injuries, including fractured ribs, broken vertebrae in your back. I don't know how disgusting and murky that water is. I really hope his tetanus shot and all his vaccines are up to date because we don't know what's swimming in that. When you fall, you want to like drop and brace yourself. So be careful reaching out with your arms because you can fracture your forearm, fracture a wrist. So keep things tucked in and try to tuck in like roll. All right, Gordon.
No, but the temperature of the sauce is...
It's plenty hot. Okay,
Dumb but tough. I love his t-shirt. Oh my gosh. What spice is he? How hot is this? The ghost peppers. Into his eye. Oh my gosh. Oh my gosh. I thought he was going to drink it. Gordon Ramsay is like laughing at him. Yeah, wipe it. Get out of there. Why would you do that? First thing you do, you gotta wash out the eye. Biggest thing we worry about, corneal abrasions, corneal ulcerations, or corneal lacerations. If you have some sort of injury to the cornea, it hurts like a son of a you're gonna need medications, pain medications, topical antibiotic ointments, or drops that we use, and then get to the ophthalmologist. What's gonna happen? Oh my gosh. I'm glad to see that there's no rope around this animal. Now he's just facing off with the animal. Oh gosh. Oh, he's like stalking him. Oh, he landed on his head. You can have a horrible cervical fracture. You can break any piece off the vertebrae. You have all the muscles of your neck to protect you, but just the way he landed doesn't look good. Thank gosh he landed at least on mud, a little bit of give.
Man, I got ups.
Oh, yeah, you do.
Oh, yeah.
You're over the rainbow.
I was over the rainbow.
He got lucky that it didn't get spiked by one of those horns that looks like they've actually been de-sharpened versus running of the bulls, which happens every year in Spain and it's super dangerous. He's riding the Red Rocket. There you go. We deal with a lot of explosive injuries where people light off fireworks, eye injuries, explosive injuries to their hands, blow off their fingers, a lot of lacerations from that. 3, 2, 1. Holy cow. Wow. If he's landing on his head, you can cause cervical fracture, spinal cord injury. Or if this large big red rocket lands on him, does it cause any injuries? If he actually got accidentally knocked unconscious and is not wearing anything that'll make him float, you increase the risk that he might drown. Obviously, they have people standing by to make sure that he's okay, but that's another thing you need to consider.
This is the 460 Stingmore mine. It has approximately 745 caliber rubber balls in it. They'll fly out of there at about 500 feet per second. One,
they're wearing eye protection, thank gosh. You're gonna get a ton of bruising. The chance of breaking a finger, maybe if they're too close, it could break a bone. Oh, holy cow. The things you actually think about that's gonna happen in a couple days is all the muscle breakdown, something called rhabdomyolysis, which then can cause renal failure or kidney failure, clogging up of the byproducts of muscle breakdown.
The stuff that your muscles don't like.
In the kidneys.
Hello.
Hello,
my name is Johnny Knoxville. We have professional football players, Eric Ainge, Jared Allen.
Oh no. Oh! You're getting hit in the chest, in the epigastric area. You're gonna have trouble breathing due to potential spasming, getting the wind knocked out of you. Unconscious? No, in pain. Oh.
People don't realize football is a game of physics. Speed and velocity equals that.
You gotta worry about head injuries. It's come to light over the last many years. Football players are potentially prone to something called CTE, chronic traumatic encephalopathy, which is a progressive problem relating to swelling around the brain due to multiple head injuries. Oh man, you can have a sternal fracture, you can have rib fractures. You can also have something called a hemothorax or a pneumothorax relating to fractured rib causing a puncture of your lung, which then collapses your lung and then potentially has even blood going in that space that is now empty air.
Hello, I'm Johnny Knoxville, and I'm about to backflip this bike.
Okay, all right. What the heck? I ride motorcycles. I always wear full gear, helmet, jacket, gloves, pants, heavy boots. I always see in the emergency department if somebody comes in and they're wearing all their gear, usually they're okay. When somebody's not wearing gear, usually they're not.
I just saw the bike. I was going up and I saw the bike. I was like, that's probably coming down.
Oh! You got a hot engine, you could potentially burn yourself. It's coming down at a weird angle. You can cause a laceration, a lot of ecchymosis, contusions. Could you snap a bone? Absolutely. I've seen lots of people that don't just break bones from the falls, but actually from whatever is falling on top of them.
What does that mean if blood's coming out? Like rupture something? And I feel fine. I just felt like I was pissing my pants, but I realized it's just blood.
What? He's got blood in his groin.
You broke your penis. Wow.
You can actually injure your urethra and pee blood. You can actually injure your kidneys and pee blood. Oh man, is this pre-Lady Gaga? Didn't she have like a meat suit or something? We got some German Shepherds on board, and I have a feeling this is not going to end well.
I got a bad feeling about this.
I just like how gentle the pups are. I've seen injuries related to law enforcement dogs. Really, really hard to repair. It needs to be washed out with antibiotics. Fracture or puncture of the bone due to a dog bite increases your risk of osteomyelitis. That area may need to be amputated off. So it's very, very serious. Do you guys have a pet? Let me know in the comments because you guys know what kind of pet I have. Oh, these are so much fun. He's not controlling it very well at all. Super dangerous. He's not wearing any protection. He looks like he's sliding down concrete. If you slide on that stuff, it's going to burn away your skin. You may need a skin graft if it's really bad or a large surface area and it's deep enough. Oh! He lands kind of funny. You can break your hip, you can snap your iliac crest off, you can get a concussion, cause facial fractures, lacerations. A lot of times things look like a ton of fun, but at the end of the day, if you end up getting injured, is it really worth what you just experienced? What is he doing? Oh man, rollerblades, baby. Oh! Oh! It looks like he smacked his face right on the concrete. You can actually hit your knee, you can dislocate it, you can fracture a lot of different things when you land into that ground if it is not deep.
What happened? I twisted my ankle a bit yesterday.
Oh, well, you can see the lateral malleolus, which is the lateral side of your ankle, the outside, is all swollen and puffy. It's a very common area where you can actually have a sprain, which is a rupture of the ligaments, which there are 3 major ligaments over on that side.
Hi, I'm Johnny Knoxville, and I'm going to get an x-ray.
An x-ray is only going to show us if there is a fracture or if there's like a widening of the joint spaces. It won't tell us if there's any rupture of tendons or ligaments or muscle injuries. So a lot of bruising. The other word we use in medicine is called ecchymosis.
So we'll put you in an air splint here, see if you can tolerate that. We'll put you on crutches. I'll copy your x-rays for you, and I don't think you're doing stunts for several weeks. The doctor's putting him in an air splint, so it doesn't allow for the inversion or the eversion of the ankle, which can make it worse. It's probably sprained versus fractured.
I'm Wee Man, and this is a yoga ball.
Oh gosh. Wait. Is that a yoga ball? I don't think it's supposed to be used as a defensive mechanism. And it is red. Do bulls see red and get mad? Let me know in the comments if anybody knows about the color red irritating a bull. Oh jeez. Oh. At least he's wearing a helmet. I love it. And there's no horns, thank goodness. Oh! There's something called the middle meningeal artery. If that actually ruptures, you can get something called an epidural hematoma. It actually causes something called a lucid interval. You might lose consciousness, and then you're totally fine, and then all of a sudden you can potentially wake up dead. We'll ask questions. Did you lose consciousness? Did you get hit in the side of the head versus hitting in the front or the back? Get out of there.
That was one big son of a dude.
I love it. They're also doing it on mud, nasty, but mud kind of like soft versus hard, solid ground. So that probably plays in a factor of when you're actually landing on it.
I'm Wee Man, and this is the swamp chute.
Swamp chute. Oh my gosh. Swamp equals alligators. That's all I think about.
They eat people all the time.
He's got eye protection so he can see, but no head here. Oh my gosh. Has anybody ever been on one of these airboats? I've never been on one. Would love to go on one. Would love to drive one. Oh, nice. Hold your ground. Oh! Oh! He got thrown back there so far.
Oh, come on!
He might have smacked into a tree, which can fracture bones to cause dislocations. If you're just hitting water, it's not cushiony. It's basically hitting it at the same speed that you hit concrete. So it definitely does hurt. I love how they're like clapping. Yeah! He made it.
I can't hear, kind of.
I can't hear, kind of. Well, hopefully he didn't perforate an eardrum, and now he's getting swamp water into his middle ear.
This is the invisible me.
Oh, that's it. They did a really good job. This is hilarious. Is it a bathroom or something? Oh no, stairs. Could that startle reflex cause any major issues? Sometimes you can skip a beat in your heart. Sometimes it actually could send you off into a cardiac arrhythmia if it skips a beat and then hits again on the wrong beat again.
Not quite my tempo.
Not that frequently. It's pretty rare.
Now we're going to send Dunn down with cattle prod.
It's messed up. It will cause issues at the point of contact on your skin, burns, scarring, breakdown of some muscle tissue down there. So it's not without injuries. Don't be using these on your friends. It is not cool.
All right, whoa, dude, whoa.
Let the unholy sacrament begin.
What is it? Is it a vulture? It's got to be a vulture. Look how cool that bird looks, though. That is pretty amazing. A bird that big, the bite and the talons are going to cause some damage. Oh! Wow! I have had to sew up people's lacerated penises before. You don't always on purpose get an erection. So you're going to have these sutures in there, and all of a sudden your penis is going to stretch. It's going to be quite painful.
He's bleeding.
Oh, come on.
The beast is drawing blood.
That's so messed up. Obviously, if that comes to the emergency department, it's a laceration. We need to clean it. We're gonna give you antibiotics because we don't know where that bird's mouth has been, what it's been eating. It's definitely gonna have a higher risk for getting infected.
I'm Wee Man, and this is the cheetah.
Well, what is the cheetah? I love that he's always wearing eye protection. At least he knows like the eyes are very important.
Ready?
What is the cheetah? Gonna get paintball. This is gonna hurt. I hope he's wearing a cup.
Fire.
Oh my God, he's taking it so good.
There's got to be a better way to say that.
Oh my gosh. Ow.
Bleeding.
Yeah, you're definitely bleeding. Oh my gosh. Most of the time, you're just gonna get large hematomas to the area. Bruising, basically. You'll have some like big welts. They'll change different colors. They'll go from blue and purple, almost close to black, and then it'll start changing to like greenish yellow and then eventually disappear. But they hurt. That's gotta hurt. It's interesting. He's able to stand there for a short period of time because the body doesn't realize it's in a lot of pain for a few seconds, and then boom, it hits, and then you're in just a lot of discomfort. He was smart to turn around and then just couldn't take it anymore.
Hello, I'm Johnny Knoxville. Welcome to the Dum Dum Game. Our lucky contestants are going to be answering trivia questions. All these questions are on a 4th grade level.
I love it. They're all standing there in their skivvies. If it was a medical question game, I'd probably pass, obviously, with flying colors. But like, I've been to restaurants and bars where they have like trivia night, and I'm not the best at it.
If you get them right, you're safe and in the clear. And if you get them wrong...
Is it a sandal? That's really funny. At least they're using like a soft thong sandal versus like a Birkenstock.
Wee Man, question. What family of instruments does the piano belong to?
Strings.
It's a percussion.
Oh, the noise makes it even worse. Getting hit in the nuts.
Getting kicked in the nuts.
Everybody in their life who's got a pair know that it hurts. It radiates into your abdomen because your testicles were actually inside your abdomen and then they descended. They're putting crazy glue on these guys.
Oh, that's good. Okay. Oh no.
Oh, hilarious.
2 minutes. Someone time it. 2 minutes. 2 minutes is the longest 69 of it.
We'll use some glue in medicine for lacerations that cut through the skin, but maybe not super deep. Especially in the pediatric population, we're actually using sutures and lidocaine. It's a little bit more traumatic to the kid versus just gluing it back together.
Somebody go get me the stun gun. No!
Oh.
Come on, no.
Yes. Oh my god, that is so funny. At least there's no blood. I would expect more hair to be ripped off the body. The craziest things that I've seen with crazy glue is getting into somebody's eyes. People accidentally mistaken the glue bottle for their eye drops all the time. What is that?
That's a good
Oh, that's so gross. Who has actually tried that? I've never tried that. Who's tried to light the fart on fire? People will singe their butt hairs and the fire will go all over the butt. So don't do that. You're gonna get first and second degree burns. Oh my gosh, they're at a driving range. So they're wearing a helmet, good. I've actually literally gotten hit by a golf ball. I had a massive bruise on my hip buttock area.
Directly in the buttocks.
Golf ball is spinning. It actually grabbed the tissue and ripped it open. Oh, he got him! He got him!
You got it right there.
He got him right down where the sun don't shine on the front side. Oh my gosh. Ibuprofen, ice it, relax. If it starts swelling to where you can't urinate, get to the hospital.
This is all flour for our friend Bam. We're gonna antique him when he gets here.
Flour, it's probably fine. It can cause somebody to have an asthma reaction, require maybe an albuterol inhaler. And sometimes people go into bad fits that actually require hospitalization.
How much? How you been? High five.
Oh! You get hit, unassuming, your head actually kind of goes forward and then it goes back. Now you potentially have a whiplash injury.
I think I got whiplash.
But look, he's okay, which is good. Perfect that there is a first aid kit right there. Remember, obviously these guys are trained professionals. There's medical staff on scene and it's a closed set. They're doing it under supervision.
Oh, good morning, man.
Oh, even worse, it's like first thing in the morning where you're trying to get your cup of coffee in and you're not even fully awake yet.
And this is the brand, and it's gonna suck.
Oh, branding, it's gonna cause a deep burn, and just depending on how long it's there, how hot it is, can lead to a first degree, second degree, third degree burn, and then scarring thereafter.
You better get ready quick.
This is such a bad idea. It's like a cookie cutter. That's what it looks like when you're trying to make cookies. Obviously, it's a phallic symbol. Oh! Some people get keloids, which are basically scars that are so hyperactive that they leave big bubbles on the skin. I guess the biggest place we ever see this is livestock. And then sometimes people do this as like tattoos. The first thing you do when you get a burn like this, yes, you can try to cool it down for symptomatic relief, but the injury has already happened. So now if it's an open wound, you want to treat it with ointments and topical antibiotic ointments just to make sure it doesn't get infected.
This is Electric Avenue.
These handheld tasers, they obviously cause shocking and pain to the area, but they're not being held onto the skin. Of my experience, when people come to the emergency department after being tased by law enforcement, it's typically the ones that actually get shot out and the barbs connected to the wires. Oh my gosh. Go, 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 quickly. They're getting some energy and pain to the area. The things you worry about are superficial burns and injuries to the skin. You can actually have muscle breakdown underneath, which then could lead to rhabdomyolysis and then kidney failure. It could potentially cause cardiac arrhythmias, which then can obviously mess with the heart. I'm laughing because I chose to do one of those Tough Mudder races. At the end, you had to run through a gauntlet that had electrical wires hanging down and that they were all different charges. It stung, it zaps you, just like these.
We got ghetto defibrillators.
Defibrillator, basically, it's your heart could be in fibrillation. So you're overriding it with all this energy to get it to pause for a second and then try to have it almost reset. With ghetto defibrillators, what? So I love how they have like these weird handles. At the hospitals that I've worked at, I can think of maybe one that still has old school paddles.
Where are those little heart paddle things that George Clooney uses?
Typically, there's like pads that are one-time use that are sticky that just go directly onto the area. They got their short white coats. Most of the time in the United States, a short white coat means you're a medical student or a student in like pharmacy school or PA school. And then when you get the long white coat, that typically means that you have your license to practice medicine. Unless you go to the butcher. I don't know what degree they got. Oh geez. That made a noise more sounding like a taser. When we actually do defibrillation, it's actually one big pop of muscle contraction. That looks like, oh, that almost looks so much fun. Ow. Right on that sciatic nerve that comes out at the butt, right where he's kind of holding it. You literally worry about fracture of the femur itself. So we call it the hip, but it's typically the femur that breaks. So you have the ball in the socket and then the femoral neck and then the shaft all the way down.
This is the blowback.
What the heck? Oh, it's such a bad idea. Oh. Bam, took it right underneath the chin into the neck area. You can lacerate the neck itself with this piece of wood, cause carotid artery injuries, jugular vein injuries, but with a blunt trauma to the area, you can actually spasm out the vocal cords, which could block your own airway.
That was great. Did you guys stand there beforehand and go, let's just be enthusiastic and encourage this thing?
No, that looks funny.
That looks funny.
Yeah, man.
I wish you guys had a cam, because that's where that pole went.
Oh, Ryan takes the pole right to his groin. If that occurs, you have the increased risk of penile injury, scrotal hematomas, ruptured scrotal sac, not to even just say significant amount of abdominal pain.
Here's the flyer nut high five.
Flyer nut. Why? Could you fracture a femur doing that? Probably unlikely unless you have an underlying bony pathology going on. Obviously, you're going to have injury to the huevos.
Say adios to your huevos.
Why don't you guys take your shoes off? Why don't you shut the f up?
I guess Bam got Ryan more on the nuts, I guess, because he's walking away versus him just sitting there chilling. Blood within the scrotal sac itself and then testicular rupture is probably very unlikely, but it'll hurt significantly. They might have been wearing cups. Maybe. We don't know. Please don't do this.
Spread your legs.
There you go, let go, you're good.
Oh! Imagine that branch splinters off and punctures into the perineum, which is the space between the balls and the anus. I've seen people who have bad infections in that area. There's something called Fournier's gangrene, which occur in diabetics that can get bad infection in that area, cellulitis. Oh, why is there a theme of Bam and his testicles? I don't understand. Outside of having puncture, you can have a lot of bruising. For a lot of trauma and injuries, we will actually examine that area, make sure that there's no bruising of the penis, the scrotum, and the perineum, because it also could be a sign of really bad pelvic fractures. Falling back like that, you can definitely smack your head on the concrete. And when you actually smack your head on the concrete, people get lacerations. The trauma actually makes the tissue explode open. Sometimes it'll go all the way through, and we have to make sure that the gala is intact with an overlying connective tissue that keeps everything together.